Good day, people. Today's talk is about blood clotting, the biggest reason for unrelated deaths in COVID. My name is Stefan, natural health practitioner here from Pretoria in South Africa. And so it's more of an educational kind of talk where we're going to look at different aspects of blood clotting, and that is one of the major reasons for COVID deaths, as well as a solution, natural solution to the blood clotting threat. So if we look at the following picture, we'll see that, let me just enlarge that. If you look at this picture, you will see that fibrinogen is a short chain protein and produced as a result of inflammation caused by blood clotting. So you will see these little fine threads over here are short chain proteins that is caused by inflammation, and it binds with platelets in the blood, and it's actually causing blood clotting. So in the next slide, we see that if there is damage done to an epithelial wall, that can either be an artery or an alveoli in the lungs, can happen in the gut, any place where there's epithelial cells. And if there's damage to the epithelial wall, then immediately we need to patch up that area. So there is fibrin, these small chain, short chain proteins being formed immediately in conjunction with inflammation. So inflammation is the alarm that goes off and says, here's a problem. So immediately the fibrin is there, and then thrombin being released by some of the white blood cells, especially the macrophages. They also release this thrombin and also being produced then in the blood to form clots. Then the fibrin forms the net around those thrombin, those platelets, and the thrombin is the glue that glue the whole process together. And then we form this little clot, and this clot then prohibits bleeding. So it makes it difficult then to lose the blood in that area, and it forms a sticky area, and it sits there and it clots it up. Now this is a life-saving thing that happens here, because you can think that bleeding to death will be the result if this artery cannot be blocked again, if damaged and cannot be blocked again. So how does this happen in a normal situation? You might have this patient with high blood pressure, which puts this artery under stress, and some dangerous particles like a nicotine particle, even salt crystal, can just prick the artery there, and under high pressure it can cause a little tear, and immediately we have this blood clotting response, and it blocks that area. So now cholesterol is body putty, and cholesterol now comes and just forms a layer on top of that, and that's where most of the plaque is formed inside of arteries. So what happens with COVID is that the macrophages, those are the big cells, the big white blood cells, which is seen as the bully cells in the blood. These macrophages indulge microorganisms like the COVID, for instance, and they are the demolition and clean out crew of the blood. So they just come in and they break down fiber, they break down cells wherever needed. They just demolishes the protein and clean it out. they come in and demolishes the microorganisms, um, everything that's not supposed to be there. These white blood cells will just come in and demolish it and clean it out. They go like creepy crawlies through the blood, and they just pick up toxins and get rid of it. So what happens in the alveoli? The alveoli are little sacs inside of your lungs, and this is where oxygen then is loaded onto your red blood cells. So we inhale the oxygen, it's then loaded on the red blood cells and taken into the cells. So in these little capillaries around the alveoli, that's where things are happening. So if COVID comes into your cell, it immediately sets off alarms through the antibodies. And then these white blood cells that come from your bloodstream into the alveoli for protection will then attack this foreign material and kill it. At the same time, the inflammatory genes, as part of the alarm system, will create an inflammatory response. And this inflammatory response causes then these white blood cells to release some thrombin, and then fibrin is formed. And this fibrin and the thrombin binds together, and it actually forms a clotting effect. So what happens inside the cell is the following. Unfortunately, the macrophages, which is there for protection, may also chew right through the virus-laden air sac lining to the blood vessels that could surround the area. This is the place in the body where the blood picks up the oxygen that we breathe in, and these macrophages in this battle with COVID, we don't really know who's actually causing the damage. Is it either the COVID, or is it also the white blood cells, or the fact that they're fighting in this area? But there's damage done to the blood vessel itself, and this sac, this alveoli sac, can then be filled with blood, and then a protein produced by this macrophages on their surface called thrombin being released, and it causes this blood clot. When a blood clot forms, an enzyme, thrombin, interacts then with the fibrin, and it forms then a blood clot.
This one.
This out of the way. Okay, so page down. Oh, no, only here. Okay, next slide. So back to the picture, we'll see that within 0 to 7 days, this is what can happen inside of the lungs. That is the formation then of this fibrin. And if we look at a different picture, you will see that the fibrin is actually looking like a spider web, and it's catching up everything in the surrounded area. And even with this picture, you will see that it forms then these little clots and makes the blood thick. Immediately it makes the blood thick then inside of this alveoli, and we can't get oxygen then onto the red blood cells. So what's actually happening is you start suffocating in your own blood. And this is the major reason of COVID causing deaths, is this coagulation, clot formation in the blood itself. So we have to come up with a solution for this. In a clinical trial, you will see the PubMed ID, this one. So if you Google PubMed and you put in this ID number, you come, it leads you directly to this clinical trial. This clinical trial says polyphenol compounds belonging to flavonoids inhibit activity of coagulation factor X. So this study shows that certain polyphenol compounds belonging to flavonoids. So these flavonoids is in the covacidin compound in the virucidin. So we've got all these different kinds of flavonoids in the virucidin that can inhibit activity of coagulation factor X. So that means it works against this coagulation problem in the lungs. The same goes for this study. Prothrombin inhibitory activity of some polyphenolic compounds. And this also is a PubMed study published in Medical Chemical Research. This is the name of the publication. And this clinical trial shows that with a biocore analysis, it demonstrated that cyanidin and quercetin, both flavonoids in virucidin, caused a strong response in the interaction with immobilized thrombin. So what it boils down to is this, that the cyanidin and quercetin, both flavonoids in virucidin, is able to immobilize prothrombin. And the thrombin then, that's the component that causes stalling of the blood itself. These thrombin chemical compound can be broken down by cyanidin and quercetin. So we don't get this over-response that leads to clotting. Our result suggests that polyphenolic compounds might be the source that is nature-based, safe, orally bioavailable, and the direct thrombin inhibitors. So it inhibits the clotting effect. So you can still have the inflammation, but it inhibits the clotting effect. And that's exactly what we want. We don't want the blood to clot, and because that then can fill that alveoli, clot the alveoli, and you cannot transfer oxygen into your red blood cells, and your whole body is suffocating. So cyanidin and quercetin and virucidin can prevent coagulation and break down the fibrin. Right, so you can see that fibrin that actually forms a spider web. So think for yourself that if there's a microorganism over here and the white blood cell wants to take out this microorganism, it runs right into this net of fibrin, which makes it very difficult for white blood cells to attack foreign material. If you look at this picture again, you can see that this blood is moving around freely and it's indulging microorganisms. If this cell is tangled up in the fibrin, it's basically ineffective. And that makes it then difficult for your immune cells to get rid of the invasive microorganisms. And this is how COVID can actually run away from our white blood cells and make it difficult for your immune system to get hold of it. So obese people with bad inflammatory genes is at greater risk of COVID-associated cardiac failure due to the fact that inflammation, chronic inflammation caused by certain genes forms the clotting process. So there's a specific gene called PPARG. This gene says if you pick up weight, it increases the inflammation. So then obese people with this PPARG gene is at greater risk for developing clots. And therefore it's so important for them to take virucidin on a regular basis to prohibit blood clotting. So a very important factor is obviously in this times, lose the weight, try to lose the weight, get rid of the inflammation. And the way to do that is with virucidin. So the question is then, Stefan, will virucidin then get rid of plaque formation in the blood? That's still to be tested. But if you look at all the different kinds of studies already done in that area, it shows that quercetin and cyanidin in virucidin is able to break down clots. So if it breaks down clotting, you can might as well just on long-term use of virucidin, start opening up your arteries and get rid of plaque in your arteries, which is a very effective way of eliminating your cardiovascular risk. So when we have a look at the effect of virucidin, we see that the plan is, first of all, block the virus on the cell membrane so it cannot enter the cell and replicate. Secondly, virucidin increases the amount of zinc taken up into the cells. Zinc then sits on the ribosome and blocks the ribosome. That's the factory where um, all these different kinds of um, uh, uh, where the virus comes into your cell and use your ribosome to increase itself and replicate itself, then released into the bloodstream. And that's where it comes ending up in your cells, in the lungs. We also breathe it in, comes straight into your lungs. So if you don't have an effective immune system that can immediately detect, mark, and kill the virus before it replicates, that then will lead to coagulation in the alveoli itself. So going back to this picture again, you will see there's your virus cell coming into the alveoli, and there's the white blood cells hanging around there, being released through the lung capillary into the alveoli cells in the lungs, attacking the virus and kill it there. But due to a huge amount of viruses coming into the cell, it forms then this inflammatory response. The inflammatory response lead to the build-up of fibrinogen fiber, which thickens the blood, and the thrombins attach to that, and it causes stalling of the blood. So again, just to sum up, is that virucidin, the quercetin, and cyanidin in the virucidin, two studies that I've shown you now, clinical trials, show that these two components is able to break down the thrombin and the fibrinogen, and it is working against clotting. And that's what we want. We don't want the blood to clot, but the inflammatory response is there for the white blood cells to attack the virus and kill it. The golden rule is we've got to block the virus so it cannot replicate. We can handle 1 cell, 2 cells, 3 cells, but 1,000 cells once into your alveoli will cause havoc in the alveoli. And that's why it builds up from 0 to 7 days. You will just see that patients are weakening and weakening because they lack in the components that can help break down this fibrin and this over response in the blood of inflammation. So we have to fight against the inflammation, and this is where the procyanidin is very effective in that in the virucidin, as well as the proline. Proline, remember I said to you in the past that the proline is our immune modulator, and this immune modulator then prohibits the over response. It protects us against the over response of the inflammation in the blood itself. So to end off, the virucidin is very effective in breaking down inflammation. It's very effective in modulating your immune system, and it is also there then to break down the fibrin produced by inflammation and stop the clotting process. So having this in mind, I would say um, if you experience um, difficulty in breathing and your oxygen is dropping, take 6 virucidins as quickly as possible. Say, for instance, with 2 capsules every 2 hours, which is a very high dosage, so that we can bring in large quantities of quercetin and cyanidin to stop this clotting process. It's always good. I've done a clinical trial for um, what's this um, cell products. It's an oxygen product that helped to break down the fibrin also in the blood, and so it actually helps them to improve your oxygen consumption in the blood itself, and it stops the clotting. So cyanidin, quercetin, and virucidin can help you to save your life. Thank you, people.